It's no surprise that there's a lot of content in our nursing curriculum that we're required to teach. However, one thing we know about the learning journey for our adults, just because we've taught doesn't mean that students have learned. Students give us feedback about whether or not they have truly developed deep comprehension of concepts through formative assessments such as discussions or quizzes, as well as summative assessments such as exams. Welcome back, everybody, to Dr. Sellars Educate, where our mission is to support all nurse educators on the journey to achieve excellence and to pass the certification exam. That's the CNE, CHESI, and for some colleagues out there, maybe you're on the journey to achieve certification as a CNML. We know that there can be barriers along the way, so that's what we're going to talk about. What happens when teaching does not equal learning, and most importantly, what are some of those specific tactics and strategies we can use to help ensure that that barrier isn't one that we experience? Specifically, what are those 3 barriers to CNE success? Not only CNE success, but also learner success, right? We want to go deeper than only talking about CNE. We also want to talk about how can we truly engage with our adult learners in the classroom so that they are engaged in this facilitation of learning that's really important in order for us to achieve our learning objectives with our students. So number 1 is going to be exam strategies. What types of techniques do our students use to help them prepare for exams? All right, so I'm going to ask you all that same question. What strategies are you using to help you prepare for the CNE exam? I want to start out with one that's really simple. It's called count to 3. When you get to the exam questions, I want you to think about, what is this question really asking me? Okay, and then I want you to count to 3. Literally, you can do that out loud. 1, 2, 3. There's something that's activated in your brain whenever you take time to truly process that information. I want you to encourage your students to use this strategy as well. Now, they do have to be mindful about their time, just like you do when you're on the CNE journey, because you will have 150 questions on the CNE exam, and you will have 3 hours to take the exam. Second strategy I want you to use is a little bit of a brain dump, okay, or a data dump. When you get to the CNE exam, I want you to write down maybe that sticking point, maybe that muddy point that keeps being unclear, even though you've looked at it 3 different times in Billings and Halstead. Okay, so I want you to think about, what is it that you want to write down when you first get into the exam? Again, being mindful of time. For me, it was the Bloom's taxonomy pyramid, specifically for cognitive, psychomotor, as well as affective. Cognitive I was able to have some clarity about the more that I used that domain, that learning domain, in actual teaching strategies. However, I still had some muddy points about it, to the point where I didn't feel very confident. And so I really validated that and purged my brain with that information when I first entered the CNE exam testing site. So doing a little bit of a brain dump. And then I want you to work backwards. I know, a little bit of alignment with the backwards design, right? Where we begin with the end in mind. 60 days is the only amount of time you need to achieve CNE success. Okay, so just to recap, we're talking about 3 barriers and how to get over them. Okay, so the first barrier we talked about is just really not knowing what strategy to use, right? So thinking about, what are some of those strategies? One that we shared was count to 3. You're going to pause after you read that question, and you're going to think through what it is that you really know. A next challenge that we see happen is cognitive overload. So to release that, you're going to do a little bit of a brain dump. And then you're going to think about beginning with the end in mind. Your goal is 60 days, so you're going to work backwards. Okay, so 60 days from now, you're going to say, as an example, okay, so by May the 30th, I'm going to sit for the CNE exam, and then you're going to work your way backwards. Okay, week by week, what is it that you need to focus on so that you don't lose sight of your goal, and that you have a realistic, specific set of goals that you are going to achieve week by week. All right, so speaking of achievement, let's talk about this thought-provoking question and see what you think. This is centered around clinical judgment. According to constructivist learning theory, which teaching method is most likely to enhance students' development of clinical judgment skills? We have A, traditional lecture format, B, interactive case studies, or C, independent reading assignments. All right, so you can go ahead and use that strategy that we just talked about. Any one of those strategies, right? You can do a count to 3, you can do a brain dump, and you can start thinking back specifically about where you're going to be 60 days from now, which is taking that CNE exam, and what is it that you need to focus on. Okay, so for this thought-provoking question, if it's a muddy point for you or you're not sure what it's asking, then maybe you identify that as a gap area, right? And you want to, again, work backwards from that 60-day mark. You can always pause this video and come back when you're ready. All right, and now I want to talk a little bit about transformation, because that's what this is all about. There's a transaction that's happening right now. You're trading your time for knowledge, for information about how to become a better nurse educator. Let's see if you chose the correct option. So if you chose B, give yourself a round of applause. These are called thought-provoking questions for a reason. Yes, we celebrate that you chose the correct answer. We even celebrate more, though, when you're clear about the rationale. So let's talk a little bit about constructivist learning theory. If this is a muddy point, you want to turn to page 188 through 190, looking at the 3 learning domains first of all. Then second of all, we want you to turn to table 14.1. Okay, this is where you're going to see the breakdown of the 5 main learning theorists. It's also in Appendix A in the Caputi book. If you have that one as well, the red book, the CNE Review book, 2nd edition. Let's take a look at what constructivist learning theory is all about and how interactive case studies really align with this theory. Constructivist learning theory emphasizes active engagement and hands-on learning experiences. Interactive case studies provide students with opportunities to apply theoretical knowledge to real-life clinical scenarios, promoting critical thinking and clinical judgment. All right, so how many of you not only chose the correct answer, but you also have the rationale correct? Constructivist learning theory is exactly how it sounds, right? We're constructing students' deep comprehension of concepts. We do that by scaffolding, by giving feedback, also thinking about those hands-on experiences that students can have, especially as adults, in making safe patient care decisions. CNE in 60 Days, that's a program that we invite you to join us on the journey so that you can stay focused with structure, decreasing your cognitive overload that will eliminate one of those barriers to CNE success and eliminate that barrier to transformation, because that's what we want to have a deeper understanding about. The only way you won't achieve success on the CNE exam is if you quit. We look forward to seeing you in our CNE in 60 Days program. Have a great one, everybody.